I'm Dr. Zeidler, and breast augmentation is one of my favorite operations to perform. Certainly, it's the most common surgical cosmetic procedure that people undergo in the United States. And silicone breast implants are the favorite among women going through this procedure. And I meet a number of women who are interested in getting from an A to a C cup, and they're wondering what implant will get them there and what size should they have. And size is not the only consideration. Certainly there are small implants that will get them from an A to a B. There's much larger implants that'll say get them from an A to even a double D cup size. But there are some important considerations in picking the right implant to ensure the best results. So when you see a plastic surgeon, they will measure your breast width. And this really is the primary determinant of what implant will fit in the body. And how wide the breast is gives us the first determination. So say you measure a 10 centimeter width breast, then you have a couple of options. You can have low profile implants that will give a modest augmentation, moderate profile implants that stick out a little bit more, give a little bit more volume, to high profile implants that for the same width of implant will give you more volume. So you have options in terms of the size of whether you want to be a B, a C, or even a D cup size with your augmentation. Other considerations are the surface texture of an implant. They come in smooth varieties and in textured varieties. And the textured surface of an implant is designed to be a gentle form of Velcro. For women who are undergoing a more complex augmentation, where maybe a lift is involved, this implant can provide a more long-lasting look. Certainly with these implants, there is some new evidence that shows that they may be protective against capsular contracture, so they can keep the scar tissue layer around an implant soft. Now, in the last 2 to 3 years, there's a newer type of implant available in the United States. These are the anatomically shaped implants, or the so-called gummy bears, that are made out of a thicker form of silicone. And this is an implant that has been cut in half for a couple of years. You see the silicone is firm and it sticks to itself, and when squeezed it retains its shape. So these implants are able to hold this teardrop shape. And they come in all sorts of varieties, different softnesses, and also different dimensions for different breast shapes. And these can provide a natural augmentation for people who are looking for fullness but don't want it to look fake. The goal of breast augmentation is to get fullness in the breast that gives you confidence in your own skin. And size is not the only thing that matters. And there are a lot of nuances with implants that we'll discuss that will help you fine-tune your ideal look.